All right, go ahead.
Okay, I'm Morgan, and our group is doing Alzheimer's disease. So what is Alzheimer's? According to the Mayo Clinic, Alzheimer's is a progressive disorder that causes brain cells to waste away, like they degenerate and die. And this is the most common form of dementia, and it mostly affects older people. So it begins with mild memory loss and it progressively gets worse, eventually making everyday activities very hard / nearly impossible. So Alzheimer's is basically something that slowly progresses over months and years, and as it progresses, it gets worse. So it starts with mild Alzheimer's, which a person may seem healthy but has more and more trouble making sense of the world around him or her. And so the symptoms for mild Alzheimer's are like memory loss, poor judgment leading to bad decisions, taking longer to complete tasks, repeating questions, misplacing things, mood or personality changes, and you'll also see an increased anxiety. For moderate Alzheimer's, in this stage, a more intensive supervision and care may be necessary. And so the symptoms for that include, you'll see increased memory loss, an inability to learn new things, difficulty with language, reading and writing, difficulty organizing thoughts and carrying out tasks and stuff like that. And you'll also see impulsive behavior of like anger and restlessness. And then for severe Alzheimer's, people with this can not communicate very well and are completely dependent on others for their care. So they can't communicate, they'll have weight loss, skin infections, seizures, difficulty swallowing, groaning, increased sleeping, and they'll also have loss of bladder and bowel control. So for causes, there is no known cause, but it is thought to be caused by a abnormal buildup of proteins in and around the brain cells. So when these proteins fail to function normally, it disrupts the work of the brain cells and releases a series of toxic events. So these are the two proteins, amyloid, which is like a plaque, and when these build up, they disrupt the cell-to-cell communication. And then the second one is tau or tangles, and then these proteins play a role in transporting nutrients, and in Alzheimer's, these proteins change shapes and disrupt that transport. So assessment and diagnosis, the doctors will perform a series of tests and mental assessments to diagnose it. They'll assess the memory, they'll do mental status testing, neuropsychological tests, interviews with family and friends to see the changes. They'll evaluate cognitive skills, they'll do lab tests, brain imaging tests such as MRI, CT, and a PET scan. They'll also do a physical assessment to see if there's been any behavior changes. And for treatment, there is no cure for Alzheimer's. There are alternative options to help slow down the progression of memory loss and cognitive changes. And one of the most important treatment ways is to create a safe, comfortable, and supportive environment. So that could be like adapting the living situation to the needs of a person with Alzheimer's. They could wear a medical bracelet, keep keys, phone, and wallet in a safe place so they don't get lost, keep meds in a safe location, have regular appointments, and also have meaningful objects like photos around the house so it feels more comfortable and homey. And then there's also some medications that they can take to help slow the progression of symptoms down and improve the cell-to-cell communication. So the prognosis and follow-up, an estimated 5.8 million people ages 65 or older are living with Alzheimer's. And on average, a person with Alzheimer's will live 4 to 8 years after they are diagnosed. And about 1 in every 3 seniors die from Alzheimer's or another form of dementia, which makes this the 5th leading cause of death among the elderly. And so follow-up appointments include physical and cognitive examinations, make sure they're doing okay, and evaluation of the patient received from the caregiver. And appropriate caregiving is very essential to ensure the best outcome of the patient. And here are our sources.